Assalamu alaikum, greetings from ECS Heart. I'm Dr. Mohamed Al Jaabari. I'm a cardiac electrophysiologist practicing at Sheikh Khalifa Medical City in Abu Dhabi. Atrial fibrillation is a disease that affects the heart rhythm, where the patient may feel his abnormal heart rhythm in different ways. So patients often describe the heart as beating in a very irregular way, as if there is something jumping inside their heart or a fish flopping inside their chest. And atrial fibrillation causes a very irregular heart rhythm where there may be very fast beats or very irregular beats, and it can be very uncomfortable for the patient. Other symptoms that a patient may complain of when they have atrial fibrillation can be shortness of breath, dizziness, losing consciousness. Atrial fibrillation can happen suddenly, and it can be triggered by certain things like poor sleep, excessive caffeine, or other diseases like thyroid problems, heart valve problems, among others. It may last for short periods of time. It may last a few minutes, or it can last for days, or some patients are in atrial fibrillation for the rest of their lives. Not all patients with atrial fibrillation feel the abnormal heart rhythm. As a patient develops atrial fibrillation with time, they become less sensitive to the symptoms of atrial fibrillation. You should call your doctor if you have severe symptoms with atrial fibrillation, if you have chest tightness or chest pain, severe shortness of breath, dizziness, or loss of consciousness, or seek emergent medical care if your symptoms are severe. Atrial fibrillation is usually diagnosed through an electrocardiogram, which is a tracing that looks at the electrical signals in the heart. And patients have different types of atrial fibrillation, mainly divided in the sense that how long they last. Some patients have what we call paroxysmal atrial fibrillation, meaning that the abnormal rhythm comes and goes. And some patients have persistent atrial fibrillation, meaning that the abnormal rhythm stays for longer periods of time. There are several ways to treat atrial fibrillation, but all treatments of atrial fibrillation center around four main concepts. One is improving the lifestyle of the patient and preventing the disease from progressing. Atrial fibrillation tends to be a chronic disease, and it continues to progress with time. And there are certain things that you can do to prevent the disease from progressing, such as exercise, weight loss, investigating and treating diseases that the patient may have, such as obstructive sleep apnea, hypertension, and diabetes. There are other causes of atrial fibrillation like thyroid disease or valvular heart disease, and treatment of those often will also improve the atrial fibrillation. After prevention, we also then discuss prevention of the main risk factor from atrial fibrillation, which is stroke. Due to the slow movement of blood in the upper chambers of the heart, in atrial fibrillation, patients can develop strokes. And these can be very serious and cause death in about 30% of patients, and significant disability in another 30%. And so we treat patients with medications called anticoagulants, and there is a certain risk stratification that we use to decide which patients will get blood thinners and which won't. So some patients who have a lot of risk factors will get blood thinners. Others have a much lower risk of stroke if they don't have diseases like diabetes or high blood pressure. And we use several different types of blood thinning medications, and there are newer medications that are much better tolerated. The third way that we treat atrial fibrillation is that we give medications called beta blockers or calcium channel blockers, and these medications reduce the heart rate, or how fast the heart beats in atrial fibrillation, because it often is very fast. And the final way, that obviously is probably the most important to the patient, is treatment of symptoms of AFib. Atrial fibrillation can be very symptomatic and very bothersome to the patient, and so we can use medications called antiarrhythmic drugs that can safely keep the rhythm in a normal rhythm and prevent the patient from having more episodes of atrial fibrillation. Or we can do procedures called catheter ablation, where we insert a catheter through the veins of the leg and move the catheter up to the heart. And using that catheter, we're able to go into the chamber, which is the left atrium, upper left side of the heart, where we are able to create scars around the veins that drain the blood from the lungs. And those are usually the origin of atrial fibrillation, and the procedures can be quite successful in preventing recurrences of atrial fibrillation. However, in the long term, patients may need multiple procedures. The procedure can be done the procedure can be done usually within 1 day, and the patient can usually leave within 1 day, the following day after the procedure. And with patients with atrial fibrillation, usually have a good quality of life if their symptoms are controlled, and we have several tools to treat their atrial fibrillation. So in conclusion, we have several ways to treat atrial fibrillation successfully and prevent patients from being harmed by this disease. I would like to thank you on behalf of the Emirates Cardiac Society and ECS Heart.